Good evening. Welcome to the Limerick Schools Board of Education workshop number 1514. Sorry for the slight delay here. We're the Board of Education and Cabinet are social distancing in person here, and we're live streaming on the YouTube Limerick Schools page. So we'll call to order Limerick Schools Board of Education meeting number 1514. Dr. Lake, do we have any changes to the agenda?
We do not.
All right, we have a motion to approve the agenda as presented.
So moved.
Motion by Jen Miller, second.
Second.
All right, second by Karen, and we'll do a roll call vote. Mike Shamad, yes. Karen Schuster.
Yes.
Matt Alonso.
Yes.
Christy Watts.
Yes.
Mike Tishless.
Yes.
Jennifer Miller.
Yes.
And Kathy Collier.
Yes.
Yes, okay. 7-0 were approved. And like I said, in order to meet the county guidelines, we are meeting in social distance manner and with the Board of Education and the Cabinet, and we are live streaming as well on the YouTube channel. We have 4.01 discussion topic, which is the school reopening plan. I'm sure everybody's anxious to hear about it. So I'll turn it over to, I believe, Dr. Tara Sparks or Dr. Lake. Okay, Dr. Lake.
All right. Well, so tonight what you're going to see is some of the work. There's a little bit of detail to what you're going to see, but the entire plan, we're still putting some final touches on that, and you'll get that by Friday this week. So it's a fairly lengthy document, but you're going to see some highlights from each of the working areas on things that are important. Kind of the, some of our parents are going to want to just tell me what I need to know kind of information, and other parents are going to want to dive into the details of the plan. So you're going to hear from each working group, and just to refresh everybody's memory, this working group is consisted of students and teachers and parents and medical professionals and administrators, and have been meeting weekly every Wednesday since the Wednesday after Memorial Day, I believe, is when we've been meeting. We have one more meeting tomorrow, and we're going to put the kind of the final touches on that. So like we've said, through this whole situation, it's a very fluid situation. We've been going down a certain path for the last, I'd say, month or so, and in the last 5 days, things have really, conversations have begun to take a different feel for that. So we're in the process of looking at what does that mean for us and how can we do these things, and we have some work still to do, but you are going to get some good information, and please ask as many questions as you can. Just know that we're not going to really dive into the weeds of the plan. You'll have that opportunity on Friday. And again, our plan is releasing it July 20th. That release will have a short video from me explaining kind of the highlights of the reentry plan, plus some written communication. And then for the parents and people that want to dive into the, anywhere from a 25 to 40 page document of detail, they'll have that opportunity as well. So with that, I believe, any questions before we get started on any of the process of what we've been and what's led us to this point? Okay, so with that, I am going to turn it over to Dr. Sparks.
All right, so I have the pleasure of sharing with you the teaching and learning portion first. And Colin, if you progress to the next slide, we've divided this into 3 phases for student instruction. And our first phase, the way it is currently written, is a split plan between having students who opt to come to school in person and having students who opt to take a virtual learning experience, which we are fondly calling ARC to symbolize the flexibility that it can have. And even in the future, ARC stands for Accelerated Remote Courses. It is a way for students in the future to kind of accelerate or differentiate their schedule based on their individual needs. So it's got some future planning that comes with it. It's not just an option for times during COVID. I think it's really important when we talk about ARC is that it does not look like what we had virtual learning look like in the spring. In the spring, it was, we often say it was virtual by invitation. ARC very specifically is a structured school environment. We've learned a lot from our summer school planning and how that combination of live or synchronous instruction needs to happen with offline learning opportunities. So when kids are participating in ARC, there is a specific school day schedule with specific times of the day where students would connect with their teachers. So if I'm an elementary student, I have my elementary teacher throughout the course of the day. I have my specials. I have when time or what I need time, which allows me to get the differentiated supports that I need, whether that is I'm participating in gifted programming, I am I'm pursuing strings through the orchestra program, I have special education services or reading to make sure that kids are still getting what they need. And then at the secondary level, it looks like a full load of courses just, again, scheduled throughout the day. Because we are looking at our students who are participating in ARC, having Lindbergh teachers the majority of the time where we can do that, that schedule needs to fuse with the Lindbergh schedule as well, so those times will correlate. However, we do anticipate that there will be some classes where our students, we may not have enough students to make those particular classes, so we will look at other online opportunities. For instance, we partner with Launch out of Springfield Public Schools right now. They're a statewide online virtual program, so there will be classes that we would access for that when we just don't have the student attendance numbers to make it work within our own schedule. But definitely a program that can support the needs of families who are opting to keep their children at home during the course of this particular time frame. So the anticipation is that students would sign up for that. There would be a short period of time where if they said, this just doesn't really work for me, I need to go back into an in-person environment where there's an opportunity to shift. But then once we get past that time frame, it's the expectation that it is for the course of the semester, and then it can be reevaluated going into second semester. Conversely, our students who are coming in person, we are looking at how we reduce class sizes, looking at schedules, looking at staffing models so that there are smaller class sizes, and we are looking at keeping kids within small, stable groups. One of the things we know and we've continued to learn about the spread of COVID is the duration of time students are in close proximity matters. So when students are going to be around one another for longer than, they cannot be around one another in small groups for more than 15 minutes. So if you think about having a small table of students working together in instruction, that is going to be a very limited time frame. We're going to limit sharing of supplies. We're making some curriculum modifications. Probably one of the biggest things that you'll note with curriculum modifications is our LEAP program, which is currently a center-based program, is going to be based out of each individual school so that students are not traveling and intermixing with students from other schools. We want to contain our student populations as much as possible. So that'll adjust some of the curriculum. Students will still get gifted services. It'll still be high quality, but it will look different. Additionally, we'll use outdoor learning opportunities, lockers at the secondary level. We won't use that because we don't want kids congregating. So really just structuring the school day very differently so that we can support our students. So that's like a quick overview of phase one. When we go to phase two, that we start to look at an alternating day program. And I'm going to walk you through as if you are a student. So let's say my last name is Anderson. I am coming to 2 days a week, and then I am working from home 3 days a week. So my particular schedule would be, I'm at school on Monday, at the end of the day on Monday, or at the end of each of my classes on Monday, I understand what I'm supposed to do independently on my own on Tuesday when I am not at school. The reason that's so important that when I'm not at school on Tuesday, I'm able to work independently is because my teacher still has classes all day long of the other half of the students who will be attending on that alternating day. So I can't expect that my teacher is easily accessible, and I'm going to need to be able to work on the opportunities to learn that reinforce what I learned on Monday. Wednesday is going to be virtual for all students, and I'll go into more details on that in just a moment. And then I would come back to school on Thursday, again, be in person with half of the students in each of my classes or my one particular class, and then working from home again on Friday independently. And then Colin, if you go to the next slide, you can see what that schedule looks like. So again, those alternating virtual days where teachers have students on both days, but it's only half of the students need to be able to work independently when they are home on those days. And we've outlined the time frames that would be age appropriate. So for kindergartners through second graders, tasks should not exceed 2 hours during the course of the day. And then you can see that increase as they matriculate through the grades. Wednesday, this is a really important day because we're very realistic that our teachers are managing both in-person experiences for students and then also providing learning opportunities for those virtual days. So Wednesday virtual days will be on a schedule so that students can can be live with their teacher. It's another touch point for students to have with their teachers. At the elementary level, that will be in the morning. It will include their specials teacher. One of the things that's really important about this alternating day is that we will move from specials that rotate on a daily basis to weekly. So if I'm a 5th grader, I will have art for the entire week, and then the next week I'll have my PE, and the next week I'll have my rotation. So that would be what it would be for the elementary level. The secondary level, we just keep the schedule of courses that we have. So as an elementary teacher in the afternoon, I have the ability to do my additional planning, collaborate with my professional learning community so we can work together on recorded lessons that are being sent out for kids to work independently on those days that they're not with us. And then the opposite is the case for secondary. Secondary meets later in the day so that teachers have that time in the morning to do the additional planning that will be required, the additional collaboration to make this plan successful. And then moving on to our next slide. Phase 3 is when we look at full school closure. So the buildings are closed, but virtual learning is still happening. And what I have here for you is that designation of what the time would look like for our students during the course of that time. So early childhood, the expectation would be that this is an opportunity for students to still get early childhood content, and it would be about an hour and a half a day. And you can see how it's broken up by those various areas of priority. And then at the elementary level, it ranges from 12 hours a week or 2.5 hours a day to 15 hours a week and 3 hours a day. Again, we are still keeping our what I need time. We're still keeping the schedules that have happened from the school year, from the in-person days, so that we can transfer that experience and that learning, those learning needs to the virtual environment. And then at the secondary level, you can see again where that progresses. Now at secondary, we would move to a block schedule so that we can kind of work with what we know about students. As we know, we've done a lot with school start times. We know students, if we can engage them later in the day, they're much more likely to be successful. So we've altered the schedule of those classes, and those classes are combined with not only the class time to do the work, but also some additional time outside of those classes for students to flex. One of the things that is really important as we do this work is that we understand the equity needs of our students. When we have families who are opting into ARC, they are making the conscious decision that yes, I can confirm that that schedule will work for our family. I can confirm that my child will be able to log in at those particular times during the day. When we're on phases 2 and 3, these are families who did not sign up for it and who might face significant challenges in terms of having their kids able to connect online at certain times. So one of the key pieces of this learning experience when we go into phases 2 and 3 are those pre-recorded videos by our own teachers in order to ensure that students have access to new learning, that they can flex when they watch those videos, that they can rewatch those videos, that they can work in their own time and with the supports that are appropriate for them when they're in their own homes. What we will use Zoom for, or live instruction, is to connect social emotionally with our students. That is very important, especially in the time that we're in right now, but also to reinforce and provide opportunities for students to collaborate with one another through academic learning opportunities. That was a piece of feedback that came through very clearly from our spring process, and that we think will be necessary to apply when we look at phases 2 and 3 going into this particular school year. So that is, I believe, my last slide, correct, Colin? If you go on, I think we move on to human resources.
So questions for Tara? Because I want to comment on a few things. Any questions for her? Yeah.
I'm just curious, like, if we have to move into phase 2 and 3, it feels like we would be able to cover the same amount of content. And I wasn't in your workers, I don't know if we'll all talk about that. Is it really speeding up that in-person instruction so that the virtual time is?
So what it's really doing is streamlining what's most important for our students. And it happens to, fortunately, we've been doing this work. So it's not something where we have to completely shift right now in the short term. We've been focusing on priority standards. We've been focusing on what are essential skills that we know our students need to master in order to move forward. So it's going to really be honing in on those skills as part of the work that we do. You're welcome.
I had a question about, on the first slide, you're talking about no more than 15 minutes in small groups. Is that going to apply to like interventions and special ed as well?
It depends on the space. So what the goal is right now, and this is where everything is subject to change. We've been doing a lot of space mining to try to find space for different programs in our schools. So if space is available, that you can be longer. You just don't want to be in close proximity to one another. So it depends on our classroom sizes. We may have to adjust how that time works differently in different ways. But our goal is, especially when you talk about IEP minutes, like the students still need those IEP minutes. So how we find the space to make that happen in those smaller groups.
I don't know if this question fits in here or goes with more student life with Jill or group or something like that, but we have parent university,
Mm-hmm.
at the high school level and stuff like that. So just somewhere in where it would fit, where we would, who's taking care of the children if we're in phase 3 and something else? It shouldn't be the grandparents.
Right.
That would be the worst case scenario. So somehow educating parents on what else would be open, being more community-based and stuff like that.
Mm-hmm.
If we have to go to phase 3 or the every other day or something like that. So.
Yeah, and we've talked about that, and families needing to have some contingency plans and knowing what resources are available. The other thing I would piggyback on with that, we are planning a parent speaker series this year. Now that doesn't necessarily hit exactly on what you were saying about childcare issues and how my kid is going to be able to connect during the day when we're in an alternating day, when we're in phases 2 or 3. But for ongoing support for families, that's a really big part of all of this plan, because we know that the online access and the understanding how to use these tools. So we will have online videos on our website for parents to be able to access and go back to over and over and over again based on whatever their need is. And then early in the year, these parent speaker series will be focused on how to make this a successful plan.
It's almost like a EHour thing. If there's some community resources that you can have or something.
Yeah. You're welcome.
If we're in phase 2 and we have to go to phase 3, like overnight, is that transition feasible, or would there be like a day out, or do we know yet?
Our goal is that these would be smooth transitions. We're doing all the work now, unlike what we did in the spring where we really had to, really plan on the fly. We have all of these plans really laid out going into this process so that we don't have to have any downtime in the transition. And I want to emphasize, one of the things that will be very important is that we're onboarding our families, our students right away to how to use platforms so that they feel comfortable and confident doing that when they are in the virtual setting.
And a question another parent had for me was, they're in high school and they're going to English and they're going to math and they're going to science. Are there different Zoom? Do they have to go in Zoom, out of Zoom, in Zoom, out of Zoom?
If they're virtual, yes, they will, because the teachers will be the hosts of those different Zooms and they need to control what that environment looks like.
A little spacing in between.
Yeah,
so they can get there.
I love that we're going to have devices.
Yes.
Thank you.
Right.
Yes.
Good timing in that regard.
Well, and I think that kind of summarizes a lot of our work that we were going to do just got accelerated. We were planning on a robust virtual opportunities for our families, and our work just had to get accelerated. Devices, we planned on rolling out middle school in the middle of the year, but now we're just going to do it earlier. Priority standard work, we've talked about what are those essential content information kids need to know, and then let them then take that and develop skills, identify passions, all the things. So this is all playing into our work, which is good. But a couple of things that I want to make sure the group understands: just because we have a level 1 doesn't necessarily mean August 24th we are starting on level 1. So I want to make sure the group understands that and that we're clear on that. It's an option, and we could go to level 2. Be on level 2 and go back to level 1. I mean, so understand this is a fluid. Just because you get to level 3 doesn't mean you stay at level 3. We might be at level 3 for 2 weeks because we've had an overtaking of a building or the entire district, and then we ease our way back and we go to level 2. And then if we think we could maybe even go back to level 1. So please understand that that is just a fluid situation. And there are some districts in our county that I believe will start at level 3. And I think there's going to be some that start at level 2 and some maybe at level 1. I don't know. That conversation, I referenced it earlier, that wind is shifting right now. So we just have to kind of see where we go. And like I said, we still have some work to do, because when you look at that survey data, it's been shared with you, but I want to remind the group, the 2 most important things that we captured out of that was if you can reduce class sizes and you do your best to social distance. That gives parents comfort level. The alternating day definitely gives us the opportunity to socially distance at a greater, with more fidelity. We can do it if we have it all there. It's a little more difficult and challenging at the secondary level because of space. In our elementary schools, we do have some space there that allows it's a little bit easier to do. So just understand that nothing that we see, and I will communicate this to our parents, our community, is black and white. So there is nothing in this situation, and we've talked about that for the whole time. So to Tara's point, all of these plans, I know we kind of went sequential level 1, level 2. That doesn't mean that's how we start. That doesn't mean how we continue. It's a very fluid situation. So I want to make sure everybody understands that.
Are you also saying like potentially elementary level could be on one phase and secondary?
Everything's open first. Everything's open for discussion. So, and what's best for our community and our kids and our families. So, but we're still doing a lot of work around the secondary scheduling and what does that look like, and the space mining, and you know how really with fidelity can we do that social distancing. So that's what I say. We have a couple more days of really fine tuning things. We're trying to make sure we dot every I and cross every T. So we have one more committee meeting tomorrow, which will finish up a lot of work there, and then we'll hopefully we'll be ready on the 20th to kind of say what level where we are and how we're gonna at that given point in time. And even then, if we do it on the 20th, it may change. I mean, something could happen and could change. So yes, Mike, did you have a question?
Yeah, just we might have this data, but do we have a sense of all of the economic and social impact on each level, elementary, middle school, high school, regarding those families? And I know we talked about resources, trying to link people with resources, depending on what level we're at. But do we have any feedback yet coming from any of those particular segments from the parents? What I'm trying to get at is some sense of, kind of, Kathy was alluding to it before, families have really struggled, particularly at the elementary level. To get together.
So I know our social workers work really closely with some of our families who are the most disenfranchised, for lack of a better word, and how we continue to support them and do what we need to do for their success, for our students' success. There's also been, I think we are upwards of 760 comments on our feedback form that we've been putting out each weekly. So we've been watching that. It's not disaggregated by specific family need, but it's given a lot of insight to what people are thinking, and we can see the increased anxiety that's been coming over the last couple of weeks in that data and in that feedback. So that's helpful information for us.
You see the data out from that section, you might not be part of the data, but a single parent family.
Yeah, it's not disaggregated like that, so families aren't necessarily identifying it.
Well, I think that Tara brings up a good point. We've seen anxiety from our employees over the last week shoot through the roof. I mean, I think at one point in time I shared, our teachers, we're not hearing a whole lot right now, or our employees, or all of our staff. But I think as we get closer, and I think as you see what's going on across the country with the uptick in cases, and even some parts of our country rolling back phases of things, there's a lot that we need to make sure we take into account with this plan. And it's a whole picture plan for everyone, for families, for employees, for all of our staff. So just know that we're seeing that. And that's not just here, that's everywhere. That's in the entire county. I mean, there's been some school districts that have actually had teachers do sit-ins and things like that. So, I mean, our teachers are in a really good place with us. So we've had great collaboration with our NEA and folks, and so we'll land in a good spot. But just I want you guys to understand and be empathetic to that there's a lot of heightened concern right now.
And over the last few days, I've been meeting with some of the building leadership teams to get feedback on this. And so it's really been helpful to kind of dive into some of the specific things that they're wondering about or questioning, and make sure that those gaps are closed when this final draft is ready to share with everyone.
and again, to my point, there is no final draft.
Fair enough.
This is a fluid, so it may be a document released on the 20th.
The July 20th draft.
But I'll just use our Compass document. We talk about it being a living, breathing document that can change and flow. This document is no different. So we just need to leave draft across the top of it. So it's like we've used the analogy with this group, sometimes you feel like you're drinking out of a fire hose. You just can't catch your breath sometimes. So.
I have a question about the anxiety, rising anxiety is, and I don't know if you've actually tried to differentiate that. Some of that just the unknown piece of it. It's not necessarily all the news of what's happening with this or the uptick in cases, but just the unknown because it's July.
I do think, having these meetings with teachers, the teachers who've been a part of it, they definitely have appreciated understanding what the plan is and having knowledge. So it does reduce anxiety, but I think there's still that concern about kids. Yeah. But it's helped definitely for those who have been, who've been able to see and talk through some of their questions.
Yeah, and we've used this analogy of, we've been swimming in this water, so we're used to it. We're comfortable in it. The teachers that have been on the task force, the 10 or 12 teachers that have been on the task force, they've been swimming in it. They're comfortable with it. I was able to be a part of a national conversation with some superintendents and some school districts that had already released their plans. The one feedback they gave us that we're still not releasing our plans yet was they wish they would have dripped more information to their entire teaching staff. So they didn't just consume it or jump straight into the deep end with all of this information and what it is. So we are hosting, for the whole board to know, we're hosting, I was going to share this with you guys in your meetings this week, but we're hosting a Zoom, 2 of them on Thursday, to kind of go over what we're going over with you today with teachers before we release that large detailed plan and let them ask us some questions, and they will actually get that before the community gets it. They'll get it ahead of time on Monday. So we're trying to relieve that. We're trying to answer the questions. Rich and Carrie, our NEA folks, are going to be co-hosts with me on a webinar on Thursday, answering questions. The rest of the cabinet will be on there as well to answer questions that we need to. So we're opening that up to every staff. It's just not teachers, it's all employees. We have 2 meetings on Thursday for that. So.
Another question I have is, how does SSD fit in here? Like, what is their plan or, for our kiddos that
They are following our model, so they are taking lead from what we're developing. And then the biggest thing that they need to plan for is all of the various phases. So plan for that at the beginning of the school year and be ready to go. But ultimately, that's case by case with families and case managers working together. A specific example is on phase 2, the alternating day. It will be necessary for some kids who have specific level of need to not move to alternating day, that they may need to go every day during that week. So those are kind of those specialty situations that we'll work through. We'll also see that happen with some of our ELL students. If they are newcomers and have low-level English language acquisition, then they might need additional time in the school day as well. So we'll work with families through the IEP process and in specific cases to make sure that what kids need, they are getting in each phase. You're welcome.
No, I apologize. I think I was using the word level. It's phases. So it's phase 1, phase 2, phase 3. So I apologize. All right. I think we're ready to move on to the next topic. This one, teaching and learning always has the most questions, but now we get into EHour, I think.
Yep.
Next. All right.
So EHour, very involved as well. Really, our task force had 2 main goals, 2 focuses, 2 audiences. The first is just to share with the public in the main plan that will be published on the 20th, the steps that the district is taking to work with and support our employees to not only keep themselves safe, but help keep students safe and families as well from the spread of COVID-19. So that general outline, so parents know basically the steps that are being taken from the Human Resources Department, the district, is there and it's in place, and it's had a great deal of thought, lots of meetings and lots of time thinking about that. The second piece of our work was to develop a resource manual, and this one is much more detailed, and this is for the employees. And this is a list of really protocols that give employees a sense of what to expect. And I've got some points on the other side of the slide I'll get to. But you should know that over time, starting on Memorial Day and then to now, we've had to be pretty quick to adapt because executive orders and recommendations change. And so I'm happy that it was mentioned that this is very much a living document, because as those things change, it immediately impacts human resources. Masks, for instance, that was an immediate issue. We had to go back into our plan that we kind of felt like we had settled and open that one back up. So quickly, some main points that will be part of the manual and part of what we share with the public. Employees will be doing a daily self-check for COVID-19 symptoms and exposure, and we've got plans in place for how to do that. That'll be part of the detailed manual. We have protocols for what happens if an employee presents with symptoms at work, middle of the workday. We will have many contact tracers, people being trained by Johns Hopkins University to be contact tracing, so we can notify the proper people that need to be notified when an employee or students are identified to be suspected to have COVID-19 or in fact test positive. Personal protective measures, we talked about masks a little bit. Certainly we have to follow the county executive's orders in this regard. Talked about cleaning protocols, deep cleaning protocols multiple times a day. One of the manual protocols that will be shared with employees is a detailed schedule of custodial cleaning schedules. And so they'll know when things are being cleaned, and it's often. Another piece about Dr. Lake alluded to drinking from the fire hose. We don't want to present this manual to our staff as just an email attachment, say, okay, go and read this, because ours also is pretty long just itself. It won't be included in the plan that is released to the public, but it will definitely go to all of our employees, and it's fairly detailed. And so tomorrow we'll be developing a screencast, so we'll go through a PowerPoint with a person narrating that PowerPoint and drawing attention to the really important main topics of the manual, and then the manual will also be included. And then in HR, we need to be visible. We need to be available to principals to come to staff meetings when there's questions. Alleviating anxieties, we've tasked ourselves with major responsibility there, and we want our employees to know that if you have any questions, you call HR. There's going to be a lot of links to our resources, our phone extensions, our email, as well as CDC, lots of resources, but we want them to know we can be the first stop. So if you have a question, you don't have to go through and look through all these government agencies or anything like that. You call us and we'll do that work with you and walk you every step of the way. I will say we've had experience with our 12-month employees starting in March that continue to come in, and those protocols to this point have been effective, and we've had a good experience working with our employees to walk through some of these scenarios and what ifs. So that's our plan, and I'm happy to answer any questions you may have. Karen was on our group also. Karen, I'll put you on the spot, but if I left anything out, and you'd like to add anything of our work that I didn't hit on, that maybe. All right.
Can you tell me, are there any either local or federal subsidies available for the school district to use if a teacher contracts it? Like, how do we ensure that they have enough sick days to be gone, the amount of time for any staff really? How do we ensure that they have enough time, that they're not coming to school because they don't have the time to take the sick day?
So our teacher leave policy is basically unlimited leave for teachers when it has to do with illness and health. And so that is something that was already in place. And right now, I'm thrilled that it's in place because it provides us with really a great insurance policy with regard to leave that those employees need to take. We're also following the FFCRA guidelines with employees that do have banked leave. But we have worked with any employee to this point that's contacted us. We've gone through with them and looked at their leave and what they have with us versus what federally is offered, and then we try to find which one's better, which one is less of an impact to them. And we have good and generous leave policies at Lindbergh, and so typically our school leave policies have been sufficient to help you through this without losing pay or draining a bank of leave, a bank of paid time off.
And that covers certified and non-certified.
Yes, sir.
One thing, Brian, that's kind of swirling out there would just be, if I go virtual, and I'm going to teach virtual under ARC and things like that, then when I come back, do I all of a sudden switch elementary schools just because I'm needed somewhere different, you know, like hopefully after COVID is vanished completely on Earth. You know, so what does that look like?
So let me answer that. Yeah, so Tara and I had a conversation around that. And so this is where we are right now, and we want to get with Rich and Carrie and the NEA, but my gut tells me that, let's say we have a third grade teacher at Long Elementary that wants to be one of our art teachers for the elementary kids. And so they do that. We hire a person to take their place for the in-person, but it'll be a 1-year only contract, and knowing that we want those people, because some of our teachers that are stepping forward are some of our amazing online teachers, and we want them to be the ones for our families that are doing that. So we want to give them that idea that you get to go back to your team, so that teacher that was hired to take their place understands, will communicate up front that this is a 1-year only contract. You may or may not even have a position with us next year, but if you do, it may not be even in this same grade level. It may be in a whole other building. It might be in this building in a different level or whatever. But we really want to give those teachers that cover, so they will volunteer for that. So we have 3 or 4 that said, hey, I'd like to do this, and they would be awesome at doing the art if we need that. So we want to make sure that's as high quality of experience for our kids as we can. So.
And this may merge the two of you together with this question too, but and thank you for that explanation. The other thing would be just scheduling and carrying it down to what we need for curriculum. So I know that sometimes when I look at school schedules, you've got what you were just saying, you have the wind time, you have this, you have that, and you're still adding all those additional, which also means students are traveling more, whether we have 50% capacity or 100% capacity, or you have a once a month, you know, character group or something like that. I really hope we're looking at the fact that we just need to make schedules appropriate just for the curriculum when it comes to that, you know, or adding, you know, the additional time maybe to like second hour or whatever hour it may be for that social emotional chat or for that mini lesson on digital citizenship or work character strong or whatever, maybe a drill, you know, we talk about some virtual safety drills coming up, you know, and things like that, that it's just, we limit the transition.
So I can give you a couple of examples of that specifically. So talking with Sparing's building leadership team team yesterday, design time has been a choice-based learning experience for students during flyer time. Now is not the year to do that. It's one more example of how students are intermixing when they don't have to be right now. And looking at flyer time going to grade level instead of across all grade levels. So those conversations are definitely happening. It's that balance of ensuring that we give kids the access to the curriculum that they need and they want, with having some stability in who they're mixing with throughout the day.
The reduced opportunities for mixing, we have eyes on all of that. And so we don't have all the details worked out yet because each building's a little bit different and the principals are working on that. We will have that all. We will limit even examples of maybe it's adults pushing into a group of kids and delivering that instead of those kids actually physically leaving their classroom, or even potentially leveraging virtual opportunities, even though the kids may be physically in the building, the teacher could be doing that remotely. Those kids don't have to leave that room in order to get that experience. So there's lots of examples of how you will move into the building. So, but without keeping that balance of we want it to be a good experience. We don't want it to be not, but the balance of safety and experience.
Yeah, pack and fire.
Yeah.
Right.
Thank you.
It's me also, I believe.
No, yeah.
So childcare, we're in the process of developing this, but we've established that district buildings, district buildings, K through 12, will be open an hour before and an hour after school. This isn't really anything new for the high school, but this will be a new thing for elementary and middle schools. We're calling this EHour, and it's really a time that's designed for parents to be able to drop off early and pick up late, so that we limit bus ridership. It's really developed to encourage people to drop kids off themselves instead of riding the bus, because buses are going to be difficult. I don't want to step on the transportation presentation, but you're going to hear that transportation, social distancing is tough on buses. So if we can set up a scenario where parents feel comfortable and it works into their workday that they can drop off at 7:30 instead of having to wait until 8:30 or 6:30 in secondary, that's good. We had a lengthy meeting today with the elementary, secondary, and Jason Kinetic, who's going to be working with me to staff this program and program it. And the makings are there, and this is, we think, going to be a great service that will limit the need for bus ridership.
Are you talking about staffing in the big bus?
No, this would be offering opportunities for some of our building assistants to get more hours. They're usually in a supervisory role, so they typically work 3 hours in the morning, which many of them do. We may be able to offer them 5 hours a day instead of 3, and they would cover that morning shift. Same thing with our afternoon people. But these would be building assistants, TAs, even people that work currently for Charlene and Flyers Club. We would expand that staff, and then Jason Kinetic, of course, brings in people for community ed, and we're going to work with him. So we'll be staffing this with classified assistant type staffing.
Thank you.
So we think a lot of our parents will put kids on the bus if they want to go and fight traffic or be at their time that they have to get to work. So they put them on. So if we can give them that hour of window and keep them all, reduce the number of ridership, that will be very helpful for us. So.
I think they'll want to continue after COVID.
Sure, that's fine. There might be a fee. There might be a fee involved, but right now we are offering them for free. But it is, we have some one-time expenses, and this is one of them right here that is a one-time budget hit.
Staffing will be the challenge for this program, and that is essentially what we're talking about with the principals. It's going to be up to us to make sure we get the people, because part-time work is oftentimes difficult to staff. So we're working on that right now.
All right, next, any other questions on the EHour program? Next slide.
Okay, it's my turn. Make it small, isn't it? That's usually what I do, make it small. Just keep up with my numbers. Facilities and sanitation, of course, is the big mark on how are we going to keep our spaces disinfected, or safe for students and staff. The custodians, there's pretty many details on here, but the custodians will clean the classrooms and spaces from students and teachers at the end of the night, at the end of the day. And during the day, they will have a process where they clean more often. So if you look to the right of the slide on there, it tells you the proposed schedule. I mean, these aren't set in stone, but it's an area of window of how they will be frequently sanitizing spaces. We're not looking at adding staff right now. We're just kind of changing staff duties to make sure that we get more cleaning in. One big part of that extra sanitizing will be, we are not going to steal from the food service report over there, but with serving the cafeteria and eating in the classroom, there will be additional responsibilities to wipe down surfaces before lunch and before breakfast. And most of those kind of wipe downs will be done with the teachers in the classroom. So every classroom will be outfitted with sanitation, Germex or wipes. Actually, we're going to have a bucket of wipes that will be in every classroom that be facility staff is making up. So not just your normal Lysol bucket, but large bucket of wipes that will last a little bit longer. And I'm sure they will be used fast. Then the main part of it will happen, of course, when students and staff leave and they get into the rooms and disinfect again every single night. So additional things that will be happening just in the building will be restroom checks, sanitizing, touched areas, door frames, doorknobs. E-mist machine is product that has come out with and more popularity with COVID, the onset of COVID, but it's pretty much a machine that go into rooms and it will sanitize it twice as fast and it lasts longer. So
It looks like a Ghostbuster pack.
yeah, it's a backpack, yeah. So Billy said in 2 weeks you can do the whole district with this. I mean, and you know, just by, and then it'll be a continual rotation with that machine. Water fountain is another one. The water fountains, the bubblers, as Beth told me that was the name of the thing you drink out of, the bubbler. That will be turned off. What will be available is the bottle fillers. And so, and of course, those will be disinfected often throughout the day to complete that clean. We will have we're adding additional hand sanitizer dispensers in the hallways. We're working with principals on that. They'll be in frequently trafficked areas. So we're putting more stuff out there to clean your hands. We're encouraging hand washing, keeping things clean. I don't know, do you guys have any questions about facility cleanliness? I mean, one part that will help us keep it clean, of course, is the limiting of visitors. You know, we're just going to have less visitors in the building. We're not opening up facility use for rental. And so just having our pods and our people here will help us maintain the cleanliness. It's a popular topic during COVID. So any questions?
No, there's some one-time, facilities has a lot of one-time costs, like she didn't talk about it, but like you see it, the grocery store, you have the shield guards, or if you go to a drive-through, so our receptionists and things, we've ordered plexiglass and things like that strategically for in the cafeteria, so those kinds of things. There's one-time expense money that we're gonna have, and Joelle created a code so we can, at the end of this year, we'll be able to
We're
report to
tracking
you
all these.
exactly how much was the one-time COVID cost that cost our school district during this time. So we will have that information for you. All right, Joelle, next.
Next.
You got the health, right?
Yep, health and safety kind of touches some of those points. This is really screening, so that's an important component of keeping our staff safe. Kind of plays along with Brian and human resources, but staff will be screened daily. That's going to be actually documented.
And that'll start August 2nd.
August 2nd. Yeah. Big, of course, I bolded it on here because really the key in this is a change in culture. It's stay home when you're sick or if you're showing any signs of symptoms. I mean, if you come to work with the list of symptoms, and the list of symptoms will be detailed in the documents that have everything in it. But if you have that symptom, you stay home or else we're going to send you home, you know. The top two are really the same for staff and students. Self-assess with their parents in the morning. That'll be something that they need to do at home. And then again, if any of those symptoms are there, they need to stay home that day. As far as the staff, they have to be cleared to come back to work. And if a staff person is sent home who is ill, we'll of course clean that area up immediately. And HR is really the one that works with getting our staff back in the building. What is not on here yet is we are also working with some of our local hospitals to make an easy and clear path for staff and students once they need to hit to the doctor to be able to go there and us get the data back. So the turnaround of sending staff home sick and getting them back well won't be so long. We know where you're going to
The
be.
test results, so we can
Test
just,
results.
yeah, so that it'll come directly back to us. So we've been in communication with Mercy on
And
that.
we're looking at another one
So-
now as well, just to make sure we have competitive.
Yeah.
So we have a specific spot they would need to go.
Well, you know, we can't tell them to go
No, you
there.
can just say it's
You
available.
know,
if you want.
we're looking at, as far as the staff side, to support that through our reserves in our self-insurance fund. that we've been doing well with managing that, especially with our wellness program being out there. We've added some funds to that. So for a certain period of time, we feel like we can pay for staff COVID testing. And that's what we're working with a couple different vendors to make sure we get the best pricing. And then if we do that for staff, it's much easier for us to get the information back. You know, in order to get back, Brian needs something to get them back. And if they're going all over different urgent cares, or they're going to hospitals to get it done, it's just harder to communicate and get back. So we want it quickly.
Well, the important thing is you can't require them to do that. We don't offer that. And it's the same thing. We can't pay for the students to do that. But if a family wants to go to their own doctor and get the test done, great. That's fine. This may take longer to get the results back. But if you say I am associated with Lindbergh, they will get you in. They will test you. We will get the results back much sooner. They will come directly back to us. Now, families don't have to take that.
They don't have to. It'll be preferred option.
Yep,
You know, we're
but
going to
they
say
don't have to.
this vendor of our choice and are your physician. But if they want to use another one, that's fine. We just probably won't get the data back as quick. Also with networking with that hospital, will be kept up to date on, you know, the quantity of shots that are available, what's going on in the marketplace. And if, you know, there happens to be a shortage, we'll know about quick instead of having a student or a staff member come back and tell us that they couldn't get the shot. We're going to stay in line with what happened in the medical field as far as COVID. There's a little bit more of this for staff. One of the things that as a result of COVID schools are doing is creating an isolation room. So when a student has symptoms and it's symptoms that align with the COVID symptoms, those students will be in what we are calling gold room. Right? Is it gold? Is
Yes.
out? I have to get my things right. Gold and green are our rooms. Green, kind of like green is go. They're good. It's a normal thing that the nurse sees. It's not a COVID related item, and the nurse will see them and keep them in the office. The gold room will be if they have symptoms related to COVID. So that is where we'll have to add some staff. The building's working really hard with the data that was prepared by our architect on capacity to pick those isolation rooms. You know, there's not many rooms in the building. There's a lot of programs we got to do. But I think as of today, all but one is their isolation rooms are their gold rooms identified. And we're getting those ready. The school nurse, of course, when the students are sent to the school nurse, and we have some parameters, layers on sending students to the school nurse, that will be part of, I guess, the HR protocols that go in there. It's more about if I have a student that has a tooth fell out in the classroom, what should I do with them? The nurse may be busy, and that will go into the protocol handbook. Apparently very popular to go to the nurse's room to get the little tooth holder that they put their teeth in. But she may not be available to hand that out. So the teachers will be doing some of the layers and assisting with that, as well as administration and secretaries. But the nurse will assess, treat, and refer the students to 3 different areas. 1, the student will return to class. It's, you know, fine, they can go back. Second, the student will be kept in the main office if it's not a COVID-related symptom. If it's a COVID-related symptom, doesn't mean that they have COVID. As you know, you can have a cough and not have COVID. Then they'll be put in the gold room with a building assistant who will sit with them until their parents can come get them. When the parents do arrive, which we're going to encourage parents to have a plan, you know, we don't want kids sitting there for hours and hours. They're going to be in a room. You know, that plan B where they have them ready to send grandma or somebody to pick up the child. The parent will not come in to get the child, but the child will be walked outside. And so that again, it limits the visitors to our buildings. So screening done at all levels. Next one. Any questions about the screening?
So this is probably a good place to state this, and I've said it to you guys, I think, but for people that are watching online. So you heard about the cleanliness and the facilities, you heard about the health and all of that. Please understand that all of these measures that we are taking and doing is not to eliminate or stop COVID from being in our building. It's to mitigate it, because COVID is going to be in our buildings. It's going to show up. It's going to be there potentially August the 24th and be there in May, whenever it is we get out of school. So all of this, and parents need to understand that. I mean, I want to be open and honest. This is to mitigate, and we have some great strategies to really mitigate COVID in our buildings. And I think we feel very good about our work and our protocols and what we have in place and the partnerships that we've developed with medical professionals and people like that. So I think as you see all of that, it's to really reduce it and keep it manageable for us to be able to operate and function as a school district. So, okay. All right, next.
Hold on, I have a couple
Yes,
questions.
sure.
Yeah,
But
sure.
Thank you for making that statement. Yes. You know, I went thumbs down. But anyway, Brian, I think that your handbook, it's going to be on the front page, will definitely say this, because it seems like if you have one symptom, you go, you have to see the doctor, you have to test. That was a little odd under staff right there. That's what it looked like right there. And I don't know if that's what you mean.
But that's where we are right now with the guidance that we have. If you have a symptom, you have to get checked out.
We have detailed guidelines of who to call. If I have a symptom, who do I call? And it's the Human Resources Department. We've got those resources, and then we would have a conversation, and then we will have a place that right now we're working on whether it's the place that does our that currently does our workers' comp. We don't know yet where it's going to be. A place that someone could go right away and get a test. Or the
it
district
doesn't
pay
mean
for it.
test here. Like what I'm reading says you have a symptom, a doctor may not even order it.
That's
Right,
correct.
That's correct.
That is correct.
Okay.
Yes, so we may send them to our workman's comp place and be checked out by a doctor. Okay, you don't need to be
Yeah, it's
tested.
not gonna be, I
As long as we
don't
get
use the word
something
workman's
that says they
comp.
can return it back to work.
Yeah, we don't want to use the word workman's comp, because it's not a workman's comp.
No, I'm sorry. Yeah.
I just was saying, referring to that as a
Same
business.
The clinic.
A vendor, where we have,
Yeah,
a vendor we have a relationship with.
Yes.
So does the same thing apply to students? Like a student,
Well,
I'm just concerned about, copay. I mean, you have a kid that has allergies, they're going to constantly have a COVID symptom.
right, you can have, that's where you would go to your doctor. I mean, the nurse would be, that's why you don't have to go to the mercy or wherever, or SSM or whatever you work with. But you need to go to your doctor or your physician.
That's where our school nurses will
Yeah.
be the ones that will make
Pediatrician
that
or
decision.
the.
Okay, so,
And
and
then
then
if
you
you
said
get a letter that
monitored by
says-
health department, so I was just kind of looking.
For COVID, if it's.
Yeah,
COVID,
but if you're showing signs of the COVID, our nurse may say
Say
you
that
need to
you
go
need
to
a
the
test.
gold room and let's get a hold of your parents and you need to go be checked out. Again, our nurse isn't gonna say you need to go get tested. It's you need to go here and we feel like you're showing symptoms, go to your doctor or go get checked out at a clinic and let them then say, yeah, let's go ahead and test you, or no, let's not test you.
And we
You
know
can
that there's
return
gonna be
back.
those allergies, like everybody has seasonal allergies.
And that's a question our nurse might ask, say, do you have allergies? What are your known allergies? Okay, so, I mean, we're gonna have to trust our nurses to be able to vet that. But again, if people don't think their lives are gonna be disrupted, it's not going to be normal. And I've said that, and I'll say it to any parent, and I will say it to our staff. I'll say, I think somebody was saying, well, we're hoping to be as normal. Well, I wanna be as normal as we can, but there is not to be normal until the vaccination is there or there's a high level treatment. People just have to understand flexibility and agility in our work lives and in our personal lives has got to be present. It's got to be, so.
And the other thing I was going to say, Joelle, is again, not grandparents. Parents pick up your kids. Do not send the grandparents to pick up your kids.
But you have to, I mean.
I know.
There's a plan B, if the parents are working,
educate.
everybody can, if they're authorized on SIS.
And I'm not saying we say no to that, we just try to limit it and try to educate them on that. Right?
For the safety of their grandparents, I would think they would,
Exactly, yeah.
but we can't stop from grandparents being on.
I know, because everybody's on an emergency
Yeah.
list, I get that, but we can still educate and say it's not the best decision.
We need to have a backup plan because it won't be normal. And Jen, to point out your thing on that statement, it really should be, if it's a COVID case, they need to be cleared by the health department. So that is, I mean, the nurses did say that, like, can't be a doctor or whatever, that the health department actually has to clear the case for the students. And what we're waiting for right now that we don't have is
Yes,
there's
that's what you
a
just
group
said.
of, it's a big piece that we need to fill this with. The data is St. Louis County has a group of pediatric doctors meeting, and then they're going to release guidelines in a matrix of if this, then that.
Yep.
And then they're going to say, what the nurses need that. They need a matrix that guides them with a flow chart of, and that needs to go to parents, so the parents know that this is what we're gonna do when we see these specifics. So I can't think of anybody better to write that than a group of pediatricians.
And Dr. Charney, who is on our task force, is a part of that.
Right. And Dr. Charney, I spoke to her several times today, and she's confident that that's going to be released tomorrow, and then we can fill these holes.
And
Especially-
Jessica,
yeah.
our new lead nurse, we created that position this year, the lead nurse. She is in that small group with the health department and them working on that as well. So she's gonna have firsthand information
And then
for us.
it'll be consistent. We're hoping St. Louis County-wide, everybody will be using that, and it'll be well-known. And that's the piece that we don't have yet.
Because what like we get a lot of times is, well, Rockwood didn't send my kid home for that, but Lindbergh, so that's why we really want this consistent document, because we all, we want to be, and that's been the conversation from the 22 of us superintendents is light as we possibly can be, the less stress it puts on our whole county. So.
Joel, when you say the CDC, not the CDC, the county health department has to clear
If a student
somebody,
is
what does that mean?
for
Like they
COVID,
provide the documentation versus the physician?
that should say on there, if it's a COVID case, for them to get back to
Positive.
school.
If you get a positive
Positive, yeah.
COVID
It's a
case,
positive COVID case. that should
Yes.
say
what
that.
kind of backlog is that gonna create?
They said, she
They
told me
said
today, Jessica Franklin, she was in that meeting, and a student cannot be returned to school until the health department releases them.
Yeah.
So I'm hoping
that's-
with that protocol that they're gonna come out of the pediatricians, that they're going to have a relationship with the health department and turn that around
Okay.
quickly. That was the comment that was made. It has to be a health department notice. I know the health department calls.
Who
See
decides
how
that
that's gonna
though? Is
look.
that part of the
County guidelines?
county guidelines right now? So who decides it? The health department is the one that has the final say.
Isn't that how it is for personnel right now?
Well, it would be, and the health department could come in and close the school based on number of absentees and things like
The
that.
health
And
department apparently right now
I mean-
gets copies of all COVID cases.
Yeah.
They're immediately reported to the health department. So if you go and get tested positive for a case, the health department knows immediately. I've heard people, nobody that I've been in social contact with, but that have had to get tested and, or their kids tested, and immediately the parent is called and says, "You've got a positive test, is this your child? This is what you need to do." So.
And again, it's probably not anything more than if you were positive, you're probably gonna need to stay home for 14 days or until I get 72 hours, maybe I've seen for symptom-free or something like that. But a lot of times, the delay in the testing is you go get your test, and so you're self-isolating or quarantining while you're waiting to get your test results, and it might be 7 or 8 days, and then, you may not, you just will do the 2-week window.
And for a student and get sent home with, well, let's just say they have COVID, do they switch to virtual, or are they not giving?
That's a great question, go ahead.
So our plan at this time, we're working on how they can still participate within that in-person setting. So we're working through different technology options so that they can still remain with their core group of kids, still remain connected to the teacher. That becomes a priority so that they're not switching back and forth and adding layers of confusion.
So it'd be a 2-week kind of thing. So in
This is
our,
how good our new lead nurse is. She's watching live on YouTube, and she replied and said, the health department said they have more than 60 staff members working to clear people. Communicable disease isn't mandated to be reported to the county health department. They will know often prior to the patient that somebody is tested positive. So, thank you, Jessica.
thank you, Jessica, that's why we hired you.
She said, I'm doing great. Ever hear that? Okay. We're trying to talk health.
Yeah.
I mean, I'm an accountant. So, I mean,
You're doing great.
You're doing
True,
great.
this really is a career.
so there are some gaps to fill in here, and like every day something new comes out, and every day we try to make this plan a little bit tighter, but then the next day we'll keep it tighter.
So Tara, to be clear, if I'm out and waiting for a test, I can still join my classroom.
Right.
Okay.
Correct.
That's where we are today. So,
Yeah,
yeah, be better.
current version.
Current version. All right, next we're getting over on some time here. So we do have
Way
Okay,
over.
this one I'll be just quick, this is pretty standard. Face masks, that is going to be required for all staff, will wear face masks at school. Students grades 4 through 12 must also wear face masks at school. Students younger than grade 4 are strongly encouraged, so we know those ones are going to have trouble communicating and using masks. Outdoors, this has been put in place really with the St. Louis County guidelines, so we are following those. Hand washing and sanitation, often having it available and often before they eat, after they eat, when they go to the restroom, so that's going to be encouraged, and we'll have the tools there for them to utilize. And then I think we've talked a lot about social distancing, and you know about our capacity study, and that is our goal, is to do the best we can at social distancing. We know that won't be perfect, but we're going to do the best we can.
question.
Shield versus mask.
So what we've been told, the shield doesn't really protect because it's open here. So if you want to wear a shield, that's fine, but you're also going to have to wear a mask. So we have explored clear masks for our teaching staff. So that way kids can actually see the lips moving. And, you know, as I've learned, there's a lot of, we all do a lot of lip reading when we talk.
Yeah.
And so
We know we don't know.
being able to do that for our teachers as well. So we're exploring, I think we got an order today. We ordered, I think, 1,200 clear masks for, again, one-time cost. The COVID, we'll be able to tell you exactly to the penny what we spent, but we ordered that for our teaching staff.
Yeah, I told you there's going to be budget amendments.
Yeah.
And shields, we do have those in stock as well. I mean, the nurses will definitely wear
Yeah,
shields and masks and gloves, and the health aides will wear that. There may be teachers that feel like they need to wear both, and we will have those available.
We feel really good about our PPE supply. When this all started, I just told Willoughby to start back in March. If you can find things, get things, and, you know, we knew, you know, it was going to be at least a year or January before we were going to be the vaccination or any kind of treatment.
So masks all day long, unless they're eating or doing pee.
Yes.
Yep. Now, that could change with the county order, but we don't feel comfortable going against what the county order.
Current guidelines.
Current guidelines.
All right, thanks. Buses. I know it's hard for you, but you need to be quick.
I'll be quick. Joel, correct my mistakes.
I will.
I'll just hit the high points.
Okay, yep.
Families have to opt in for bus service, so just because you're a student doesn't mean you will automatically get routed to stop. So you're gonna have to, that will go out with the forms on the 20th. Bus service will be limited. If you live within a half a mile of an elementary school with no hazards, there will not be bus stops there, and it's a mile at the secondary school. First student has the maps of where those hazards are, where the safe walking are. Bus students limited from home to school and school to home. Middle school activity bus will not be provided this year. Elementary schools will use, what's the name of the program, Joel?
I can't remember either.
It's nice, it would be a nice program to have anyway, where students will be scanned on and off the bus, so we'll know exactly who rode the bus that day, when they got off. So it'd be a nice little piece to have, even without COVID. And then we'll leave it up to parents to screen their children at home to determine if they're healthy to ride the bus or not. Seating, we will social distance as best we can. One of those things, everyone must have an assigned seat, K through 12. Get an assigned seat. Family members, this says may. At one point, we were saying will sit together. We will load the buses by starting all the way back to the front, one child per seat till we have to go more than one rider per seat, and then we'll unload from the front to the back. Students should wear masks on the bus, especially when we're going to hit more than one child per seat. Social distancing at bus stops really follow the St. Louis County guidelines, just like you would in any other public place. And this is a key one. All bus riders must remain in their seats and must not touch each other. Very important. Next slide, Colin. Sanitation. First student, Joel approved sanitization of buses. Drivers will have their temperature taken each day. Drivers will wear masks. They'll have access to hand sanitizer and gloves. Buses will have extra hand sanitizer and masks for students who might need it. And we'll post up some signs for the kids to remember to keep their hands to themselves. Parent transportation. So we need to follow the guidance of each individual school on drop off and pick up for parents. We have Terrell and myself and building admin. We've got a new drop off or new pickup procedure for Sappican Elementary ready to unveil. It's gonna be amazing. And then I was at Concord today. It's gonna be amazing. So good stuff coming there. All drop off pickup will occur outside of the school building, so you're not going in to pick up anything. This, along with the EHour where students can come in earlier and out late, hopefully will reduce ridership, which will help us with social distancing on the bus. And let's see, and then school employee crossing guards for each one. What did I miss, Joe? Anything?
Good job, Craig. I will say this, like Tara's work, Joelle's been working on transportation since we've been here. I think the people on the finance committee and Karen and you and Mike, this has been things we've been talking about wanting to do. So again, it's just accelerated our work a little bit because again, we've talked about what the cost of each bus is to put in service. It's very, very, very expensive. So again, repurposing dollars, being able to do other things. So this isn't necessarily because of COVID. COVID accelerated our work. We were moving this direction anyways. And so it's allowing us to do that. So. Sorry, dude. All right, last one, Jill.
Okay, so I helped facilitate the food service task force, and we talked about grab and go meals for in-person and virtual. So our grab and go meals for students in person, which would be phase 1, and some of phase 2 would be where students in the elementary level would grab their lunches in the cafeteria and return to their classrooms to eat. And as sad as that sounds to say, we know that's for their safety. The student options will still be available for some students, or be individually wrapped items for students to choose, as well as a la carte items if students have money in their account and there's a zero balance, then they will be able to choose from a la carte. So that is the elementary scenario. For secondary students, there will be grab and go lunches as well, with some options provided. It's the same as elementary. They will be provided multiple areas to grab lunch, because just the high school, for example, has 2,200 students leaving to eat, and so there'll be designated areas for them to go get their meals, and some of those will be even outside, weather permitting. They will be able to spread out around the campus, avoiding any construction, and eat in their power lunch experience. And then we are going to, I know Eric Cochran mentioned this today, that they're really going to try their very best to ask students to pick a spot in the building and stay there, to limit the number of students that they are going to be in contact with. They're going to do their very best. Now, it doesn't mean they can't ever change their mind, but they would ask that they really try not to. Also, they will have a la carte options. For the students who are strictly virtual, whether they are part of ARC or when we go to phase 3, if we ever go to phase 3, the elementary and secondary students will be able to pick up a grab and go meal wherever there is a designated area. We've been using the high school at this time. There'll be curbside pickup for parents. They do not have to have their children in the car. So that was a great change, so that kids can access that. But the meals will be at a cost with that are aligned with what students would pay for lunches during the school year, during the day, in person. And of course, students who are eligible for free review or the part of the National School Lunch and Breakfast Program would have their meals, I guess, discounted towards their need. And these meals would be fixed. There wouldn't be as many options for the students, no a la carte. And then going to the next one, it's just a little bit about the sanitation and safety precautions. The acrylic shields at lunch will be available at checkout stations. Face protections required by all lunch service providers and students during breakfast, lunch, pickup. Lunch service providers are hand washing, wearing gloves throughout the prep, distribution, and cleanup of all meals, temperature checks of employees, and screening prior to the start of each work schedule, and hand sanitizers and hand washing stations for students will be available and encouraged and will actually monitor so students are washing their hands before and after each meal. So I think that the food service is going to do a great job. They've been practicing throughout the summer, providing meals for kids in March through now July, and they have really been doing everything we can to keep our kids happy, healthy, well fed, and so I think that they are already on track.
Good. Questions for Jill? Awesome. Well, I know we gave you a lot of
Wait.
information, but, oh, Beth, sorry. Beth, sorry. Beth, you gotta go.
The most important part.
Yeah, Beth always gets cut.
Most important one.
No, my slide is really about, so you've heard a preview of what the plan is and how we're going to communicate this with our families and staff. So you all have heard July 20th, you know, that's the date that we're sending this out. Our goal in our communications committee and on our team has really been to make sure people know the why, they understand the process, and they also get those need to know items. So we've really been combing through all the pages and pages and pulling out what are the key points that parents need to walk away with in order and teachers and students to be prepared for the first day of school. So we'll send out an email message on Monday where you can score so that we can chunk out some of that information. We'll have a video message from Dr. Lake that hits the highlights of the plan and explains the process. The entire plan will be on our website, and so it will be accessible to everyone who would like to read through and see everything. We've got some graphics that I'll show you in just a second that facilitate families having this conversation with their children before they come back to school and say, here's what will be different at school. So we really want to make it as clear as possible. I talked about the website a little bit, but there you'll see the plan. You can read about the process. People can provide feedback. So one of the things we're doing, we'll have a Google form where people can provide feedback on our plan. As it's been mentioned, this is a living, breathing document, and this is a draft that we're asking for feedback on. We're also, all of our principals are hosting Zoom meetings at their specific building where you can sign up for a 10-minute one-on-one conversation to actually, rather than just shoot an email to us, ask a question of your principal or get clarification on something. So we just really wanted to open up that dialogue for our families and give them an opportunity to ask questions. And as far as continued support, we really are looking ahead to continued support throughout this. So what signage do we need in our buildings to facilitate understanding and communication? How are we using social media and text to continue to communicate, providing our teachers and our building staff with frequently asked questions because they're really our frontline communicators. So we want to make sure if they get questions from our families or other staff that they feel equipped to answer that or know where to send people to get answers. So really what we can do to support our families in county. You can just click to the next slide, please. Thank you. I have two versions of this for you to look at, but this will be a page that, as I mentioned, families can pull up together and they can talk through with their children. That will be included in the email on the 20th, and it really hits some of those most important changes or most important things that families need to know. And if you click through again, you'll see we have another one for secondary students. So very similar, but just to get the conversation started and give our families some resources to start to prepare for the first day of school. So any questions about communication?
Is there a plan, because I know two students that haven't been out of the house since March and have great anxiety about coming around people. Is there principals going to communicate to students via video, let them know it's okay, is there something like that, or a counselor?
Yeah, so we've talked to our principals. We had a principal on our subcommittee, Dr. Brover from Sparing, and she gave us some really good input, and we really talked with our principals about how do we continue having the conversation, and principals creating those videos to especially address questions that are specific to their buildings. as we prepare to go back to school. But I know at the building level, and Sarah can probably speak to it even more, there's a lot of planning going on. Jill's worked on the social emotional piece of our plan, so just want to let you know.
Awesome.
We good?
We're good?
Okay, I know there's monumental work being done here, a lot more to do and a lot of information going to be available out there. So we'll move to a motion to adjourn this workshop number 1514. I have a motion.
So
All right. Motion by Karen, second by Mike. Quick roll call vote. Christy?
yes.
Karen?
Yes.
Matt?
Yes.
Kathy?
Yes.
Jennifer?
Yes.
And Mike?
Yeah.
Okay. And we're going to move now to a quick exec session based on our authority to do so under the provisions of Missouri Revised Statute 6.10.021 and 610.022. So I need a motion to go to executive session.
So moved. Second.
Kathy, and second by Christy. Another quick roll call vote. We'll be discussing two items, one under 14.2, which is personnel, and one under 14.0.03, which is lease, purchase, sale of real estate. So, Christy, Karen,
Yes.
Matt,
Yes.
Kathy,
Yes.
Jennifer,
Yes.
and Mike.
Yeah.
Okay, so 7:00, we will move to the exec session. If you're with us now and rejoining us, we may be a few minutes late, but we'll be back.